All right, good morning. My name is Stephen Mitchell. This is an IV insertion video. Today is 5/31/2020, so I'll go ahead and get started. So first thing I'm going to do before I get started with anything, I'm going to check my order to the physician's orders and gather all my supplies. So I have all my supplies right here already gathered together. Next thing I'm going to do is I'm going to make sure I'm using aseptic technique to make sure I prevent infection when I'm inserting an IV. And then next I will go ahead and perform hand hygiene. All right, next I'm gonna go ahead and enter the room. So not performing patient privacy. Hey, good morning, my name is Stephen. I'll be your RN today. We're gonna be inserting an IV today. Can you go ahead and just verify your name and date of birth? Perfect. Do you have any allergies, any tape, latex, anything like that? Or any medications? No? Perfect. All right, so we're gonna be inserting an IV today so we can access to give you fluid or medication. This will take about 10 minutes or so to do. And we'll go ahead and get started. So just gonna get everything together for you. I'm gonna raise the bed up to my working level. I'm also gonna ask them which hand is their dominant hand, so I can go ahead and expose the non-dominant hand because we want to use that. Perfect. I'll go ahead and expose everything. I'm gonna go ahead and take a bed liner and go ahead and place it underneath the arm. Perfect. All right. So next thing I'm going to do is I'm also going to check the protocol to make sure if the site is hairy for any reason that I need to shave it or not, just depending on the protocol of the arm. All right. So next thing I'm going to do is I'm going to go ahead and try to find a vein. Okay. So I'm going to make sure to place it in a dependent position, either bent, slightly bent or flat out. I'm also going to make sure the patient is either lying or sitting up in the semi-fowler position so we can have a comfortable position to start the IV. So next thing I'm doing is I'm going to go ahead and apply the tourniquet. I'm going to apply the tourniquet about 4 to 6 inches proximal of the IV insertion site. So I will place it right up here. When I'm placing a tourniquet, I am going to let the patient know that it is going to be pretty tight on. And then I'm also going to make sure on the tourniquet that I have an easy access to pop it one hand so we can release it if we need to. All right. So next thing I'm going to go ahead and check for the vein, but the last thing before I do that is if it is an elderly patient, I'm going to make sure that I don't use a tourniquet to protect the integrity of their skin. All right, so next I'm going to look for the straightest vein I can. We want to try to insert the IV in the most straight vein. So I'm going to feel around. I do find a vein right here that is relatively straight, and that's the vein I'm going to use. So what I'm going to do is I'm going to palpate the vein, making sure I'm checking for rebound buoyancy, making sure it rebounds quickly. All right. If the vein doesn't do that, what I'm going to do is I'm going to massage distal of the vein, work my way up toward the IV site so that maybe we can get that vein to pop up a little bit. Also can have them clench and unclench their fist. All right, so I'm going to tap the vein, again just making sure that it is rebound. Perfect. All right. And if this vein does not work, or if I cannot feel any rebound or anything, I'm going to go ahead and take out the tourniquet, and I'm going to try to find another vein. But this vein is good. And I will use like warm water, a warm compress to try to get that vein to come up if I need to. So I'll go ahead and release the tourniquet so while I get all my supplies together for the IV. All right, after selecting the vein, I'm going to remove the tourniquet. I'm going to get my IV stuff set up, okay? So I already released the tourniquet. So I'm going to choose an appropriate IV catheter according to the size of the vein. So I'm going to use a 20 gauge catheter. And then I'm also going to choose the solution to be infused depending on the provider's order. All right, so next I'm going to go ahead and perform hand hygiene and wash my hands. I'm going to use aseptic technique when opening all the IV equipment according to the manufacturer's recommendation. I'm going to have my IV catheter, Tegaderm, and I'm also going to have my IV extension tubing. All right, so next thing I'm going to do is I'm going to go ahead and flush my IV tubing. All right, so go ahead and flush the IV tubing, which I did. Excellent. We'll go ahead and move this here, prepped and ready. All right, and so the next thing I'm going to do is I'm going to go ahead and apply my gloves. All right, so after I apply my glove, all right, so next what I'm going to do is I'm going to reapply the tourniquet gently. Okay. Once I reapply the tourniquet, I'm going to cleanse the area that we've already selected for the IV site. I'm going to use aseptic swab. All right, I'm gonna start at the IV site. I'm gonna work my way in a circular motion out several inches. All right, after I let that, I'm gonna let that dry on the skin. All right, so after I'm gonna maintain sterility, making sure I'm not touching the site at all. I'm gonna use my non-dominant hand to go ahead and get the skin prepped. But I'm gonna go ahead and get my IV catheter. All right, so I'm gonna, with my non-dominant hand, I'm gonna pull the skin taut below the site of the venipuncture. All right, so once I do that, I'm gonna hold the needle and I'm gonna go in about 15 to 30 degree angle, but I'm gonna warn the patient before I go to show that there is gonna be a needle stick. Once I insert the needle with the bevel up, I'm gonna insert it through the skin into the vein. Once I do that, and once blood has appeared in the lumen in the needle, which is flashback, I'm gonna lower the catheter almost parallel to the skin, and then I'm gonna advance the needle about a quarter of an inch further, okay? Once I do that, I'm going to hold the needle assembly steady, advance the catheter until the hub is at the venipuncture site. All right, once that happens, I'm going to assess for any hematoma. If a hematoma occurs, I will release the tourniquet, I will remove the needle, and I will apply pressure to the site. Once I do that, I will release the tourniquet. All right, once I release the tourniquet, I'm gonna put pressure onto the vein with my non-dominant hand, proximal to the venipuncture site. Using my non-dominant hand with my thumb and index finger holding the hub steady, I'm going to take the needle out. Perfect. I'm gonna remove the stylus and engage the needle safety device, and I'm going to securely connect the distal end of the extension tubing to the hub. Once I do that, I'm gonna flush the catheter with sterile normal saline. And once I do that, I'm going to assess the patient for any burning, oozing, drainage, or swelling at the IV site. If that does happen, then that means I was unsuccessful and I'll have to choose a whole new site. All right, now that I have the IV inserted, I'm gonna go ahead and cover the insertion site with a sterile, semi-impermeable, transparent dressing, which is a Tegaderm. Okay, so we'll go ahead and do that. All right, and so if the site isn't clean before I put that Tegaderm on, I'm gonna make sure to use either a 2x2 or an aseptic swab. I'm gonna cleanse the area and I'm gonna allow it to dry before applying the dressing, but it was dry, so it is good to go. All right, next thing I'm gonna do is I'm gonna go ahead and label the Tegaderm. I'm gonna label it with the time and date of the insertion. I'm gonna also label the catheter size and my initials on it. Perfect, so what I'm gonna do since this tubing is down, I'm gonna go ahead and get some tape. And I'm gonna loop any tubing up so it is out of the way. So that's out of the way, so it's easy accessible. I'm gonna go ahead and discard the tourniquet. And I'm gonna remove and discard any gloves or any stuff that is around the area. So next I'm gonna check the surrounding area, making sure that I dispose of any disposable items. I wanna make sure all sharps are in the appropriate receptacle. I'm gonna make sure to clean up any blood spills according to the agent's policy. All right, after I've cleaned everything up, I'm gonna return the patient into a comfortable position. I'll make sure the bed is lowered, locked in its lowest position. Both side rails are up. I'll make sure the call light's in reach. I'm also gonna make sure any patient belongings is in with reach as well. I'm gonna go ahead and perform hand hygiene, clean everything, thank the patient for everything, and then ask them if they need anything else. And then I'll go ahead and leave the room. All right, so now I'm gonna discontinue the catheter. I've already done knock, my AIDIT, checked everything, name and date of birth. I've gone into the room. I'm also gonna check the physician's order according to what I have to make sure everything's correct. I'm gonna gather all my supplies. First thing I'm gonna do is I'm gonna go ahead and stop the anything that's infusing, any solution, anything like that. And I'm going to disconnect the IV extension tubing from the site. So I'm gonna go ahead and wash my hands. I'm gonna put my gloves on. All right, so I'm gonna go ahead and take all tape off and everything, just get everything prepped and ready. All right, so I'm going to pull the skin taut, and then I'm gonna go ahead and remove the dressing using an adhesive removal pad if appropriate. All right, so now that I've removed that, I'm gonna go ahead and remove the IV catheter. I'm gonna go ahead and have my gauze ready to go. So I'll have that right there. I'm gonna remove the IV catheter. So I'll have this here. I'll remove the IV catheter, applying pressure. I'm gonna inspect the end of the catheter to make sure that it is intact before discarding it. All right, and then I'm going to dispose of the catheter appropriately into the appropriate receptacle. All right, once I have that, I'm gonna secure that with tape and apply pressure. Perfect, once that's done, I'm gonna go ahead and remove my gloves, perform hand hygiene, and then I need to document everything. So what I'm gonna document in the computer is I'm gonna document the date and time. I'm gonna have my initials, the site location. I'm gonna do the type and size of catheter, the number of attempts it took to apply to insert the IV. I'm gonna also document what dressing I use, the patient response, and all my teachings that I did for the patient. And then I'm gonna also thank the patient, and then I'm all done. I'll wash my hands again.